At first glance, you might not notice anything out of the ordinary at this CVS store in San Diego. There's the pharmacy, the consumer products, and children in the toy aisle. So what's different here? Just head to the back of the store, beyond the shopping, and you will find one of the latest trends in healthcare. They're called minute clinics.
We offer convenient, accessible healthcare for patients where they live, work, and play.
A nurse practitioner for 20 years, Marty Wolfson is the operations manager for the 6 Minute Clinic locations in San Diego. Wolfson says for the most part, patient wait time is less than 15 minutes. And while customers may pay out of pocket for the services, Minute Clinics also accept many health insurance plans.
We do treat the minor common illnesses, such as strep throat, sinus infections, ear infections, minor things. We're not treating chronic illnesses such as diabetes or hypertension, and we're also not treating people with chest pain or major abdominal pains.
More of the clinical supplies here, tests for strep, quick strep tests, flu tests, urinary infection tests. I'm going to give you some information on the vaccine, so check that top box there.
These clinics also provide a number of vaccinations. This is the first trip to the Minute Clinic for Shanna Martinez. She is here for a flu shot.
Little stick,
Yep.
little burn.
Mm-hmm.
Great.
I didn't even feel that.
Good.
That was good.
Yeah, you can get a
sure
nice
someone
Minute Clinic Band-Aid.
I live right down the street, and I was actually here to pick up a prescription, and I saw the flu sign, and I remembered that, you know, the Minute Clinic's here, so I thought I'd stop by. I love it. I can never get into my doctor's office. They're always busy, and that's why I haven't got a flu shot up until today. So this is great. I'm going to come here probably again. Hopefully I won't need to.
The patient satisfaction rate is over 98% overall nationwide, and the patients that I've spoken with here have been very happy.
No appointment is necessary. A typical visit is less than $60. The first Minute Clinic opened back in 2000 in Minneapolis. Nearly 8 years later, there are nearly 400 nationwide.
Patients decrease their wait times by coming to our clinics for minor illnesses, and we're hopefully helping the nurses as well with their busyness.
Minute Clinics only hire family nurse practitioners that are board certified and master's prepared. There's also a medical director on call to field questions. Wolfson calls it autonomous nursing. There are no rounds to be completed here, but she believes despite being away from the bedside, this is a very satisfying option for nurses.
And they still have that one-on-one patient care. They have the time to spend with patients without a rush to see 20, 30, 40 patients in a waiting room, knowing that many are waiting. These patients are walking in and being seen pretty rapidly.
Did you ever think you'd be practicing nurse next to the jackets in the candy aisle?
You know, when I became a nurse practitioner, this was not an option for healthcare, but I think it is a nice option.
Patients who cannot be treated are not charged for their visit, and Minute Clinic only serves patients over the age of 18 months. For more information on what services are provided and if there is a location near you, log on to www.minuteclinic.com. From San Diego, I'm Mark Prescott for NurseTV.